Let's just say he was tied up.
I just happened to come in. Welcome, Dr. Holm. I
Right.
just happened to have a couple of old photos. I'm holding one up to the camera.
Oh.
Anyone who happens to be live streaming this will see his picture right now. I guess this was a couple of years ago when you still had a mustache.
Oh, it was before the gray and the age and all that stuff kind of.
Are you gray now?
Yeah. Well,
It's amazing how people turn gray and some never do.
oh, you
You
haven't
noticed
turned
that?
a little
It's
bit of gray.
amazing.
It is.
No gray at all. Hey, Dr. Holm, we're not going to talk about gray hair or whatever. Dr. Holm is here. He was delayed, of course, doing medical goodness, but right now we want you to know that he is a clinical professor at the University of South Dakota Sanford School of Medicine. Dr. Holm, I've been asking, should I change your introduction? This has been on my mind. I have. You're a primary care physician with the Avera Medical Group Brookings. Does that remain true? Or should I say a former primary care physician? How should we put that?
Well, I'm still doing nursing home care.
Okay.
So I am practicing medicine in that regard. I'm still doing colonoscopies, so I'm practicing medicine in that regard. And I will start my research project coming up in the next weeks, and that will involve patient education.
So
And
we're
will
going to
group
put
therapy.
that
So I'm
you're
gonna
a
just
physician with the Avera Medical Group Brookings.
Yeah.
Are you still a clinical professor?
Yes.
Or you're still a clinical professor? And thirdly, you are a researcher.
Yeah, in conjunction with SDSU.
Oh my goodness. That gets you with the two universities and the second largest medical center. Okay. Is that all you do in your pastime?
Right. Well, I'm on the radio.
We know
Every once
that.
in a while.
We know that. We're glad to have you here. I'm sure your mind is just flying because you had to get over here. Is there a subject you wanted to cover today? Or
We don't have any show for tomorrow
we
night because
don't.
we're being
It's the
bumped by the
Democratic
Democratic convention.
They haven't been quite as upset as the Republicans were.
No, they
A little bit more positive,
I
but
listened to Bill Clinton last night. He really has the magic words. You know, he's Mr. Smooth, and a powerful story. It was interesting, but we don't want to talk politics. We want to talk.
no,
medicine.
we don't. And we always appreciate the calls coming in. If you have a medical question for Dr. Holm, give us a call at 692-1430. Before you got here, Dr. Holm, we did have one or two calls, so I'm
Okay.
going to get to the first one. And the first one has to do about taking the meds. The person said, I know when prescribed an antibiotic, it's important to take the entire prescription. Take every pill. However, what about anti-inflammatories? I've had a swollen knee. It's fine now, but I still have about 8 days left of pills. Can I quit? They're hard on my stomach, even with Pepcid. That's the question.
Right, and the answer is, if they're hard on your stomach, I am very worried about using them in those cases. And so the anti-inflammatories people prescribe primarily for pain. Ibuprofen for joint pain, or naproxen, or Advil or Aleve. Those are the two brand names that are most popular. And there are other versions of those. Mobic or meloxicam is a version. We used to have a whole slew of those anti-inflammatories. Now we're down to ibuprofen and naproxen mostly, and meloxicam. And Celebrex is one, but it isn't quite as hard on the stomach. So those are drugs that are powerful and they're effective, and they turn off inflammation, but they burn holes in people's stomachs. They raise blood pressure, and the way I prefer people using ibuprofen or
Meloxicam
or any of those
all right.
is as needed. If you don't need it, don't take it. And if it's upsetting your stomach, definitely
Really
don't take it.
Okay. Well, that
Yeah.
really answers that caller's
So what can
question.
I do for the pain is the answer. And the answer is, if you're getting by without them, that's great. It isn't like an antibiotic that you have to take until you're done. There's a certain amount of anti-inflammation that the surgeons may want you to have, but I can tell you it's not an urgent deal, and you don't make a huge difference. They used to think that if you turned off the inflammatory process, then osteoarthritis would not occur, and the answer is, it doesn't work. It doesn't change the process. It just primarily helps you with pain. So that's the long and the short
So
of that.
what did you started to say, so then what do you do for pain? You
Well, I
didn't-
mean, if you have stomach trouble and you feel like you need something for pain, then I like to go to Tylenol. And I think, or acetaminophen is the generic version of Tylenol.
Tylenol.
And
Yes,
I like
Tylenol's easier on your stomach then.
much easier on your stomach. It has its side effects too, and so it can cause kidney problems. It can cause liver problems. You can have headaches from and chronic pain from it. I used to think it didn't do any of that. It does do that. It causes long-term pain, and the pain medicines sometimes are the cause of the long-term pain. So you've got I've changed my mind on a lot of those things.
For a while, you really did push. Years back, you pushed Tylenol, saying
did.
that it didn't harm. But now you're finding there's, I guess, any med you take will have side effects.
When Dr. Miles, Carol Miles, the neurologist who is a headache specialist, actually, I mean, she's really kind of centered her business around headaches. Has been on my show each year for the last 2 years, and every time it's one of those, wow, I didn't know that. Wow, I didn't realize that. To me, it was
But she specializes in it, so she certainly experienced many of these symptoms.
She
and
sees
problems.
rebound pain from Tylenol more than she sees it from Aleve, ibuprofen, and naproxen. And so, that's interesting to me. I did not know that. I thought that Tylenol was, really quite safe. It is quite safe, but none of this stuff is safe if you're using it all the time for pain. Pain medicines all the time, tough. I've got friends who've just had surgery or going to be going to surgery, needs some relief so she or he can sleep, needs pain medicine. He or she doesn't usually use those meds. I'm reluctant to give it to him or her. And so the point I'm making is that they're dangerous, particularly because once you get on them, when you stop them, you have rebound problems, and you have them from Tylenol. So my point, I like to use pain medicines reluctantly, conservatively. In my own case, I try not to use them. I used to say, oh, well, I'm going to go to bed, and I exercised heavily today. I just take an ibuprofen, and, I'll sleep better. Well, don't do that. I mean, you weren't made to have pills in your belly. So
Be nice to your stomach and stop taking them.
right now, if you have hypertension or if you've got heart disease or that's another story. You've been prescribed a medicine that's a long-term thing. Okay. So don't go stopping your regular prescription medicines unless you've talked with your doctor about it. But anti-inflammatories and Tylenol and pain medicines with narcotics in particular, be conservative.
You don't want to get hooked. Okay. Well, we're going to take our second break. We'll be back right after these words.
Clear?
Hi, welcome back to Prairie Doc Radio. We have Dr. Rick Holm here, ready to answer your questions of a medical nature. Just had an interesting discussion on pain meds. We had a call come in. Do you want to talk about that call, Dr. Holm?
It's from
Steve.
Steve. He said, do I still go sailing on Wednesday nights? And the answer is yes.
Okay. That wasn't really a medical question unless Steve
Listen
just
to the
needed to
doctor.
join you. Okay, Steve,
Yeah.
we got the answer for you.
Yeah,
All
no,
right.
I will be, I'm going to go to Norman Gamble's memorial service this evening. And
I went last week.
did you?
The place was locked. Well, we read it quickly in the paper. It said Wednesday, And it was this Wednesday, not
Yes.
last Wednesday, so we will go tonight.
I'm bringing my sunglasses.
Your sunglasses?
See, when he had his retirement party,
Yes.
he was wearing sunglasses.
Oh, okay.
And he said, you know, at the time, he said, anytime you're retiring or at your funeral, you should wear sunglasses. You know, he had a new pair of sunglasses and he was looking cool.
He
you know.
wanted to be cool. You know, for those who did not know Norm Gamble, he died about 2 weeks ago, and there's a memorial service for him tonight. He came into SDSU as head of the art department, and he really did a lot of good for that art department. He was a fine man, loved art, loved the students. I think he just did a great job.
I totally agree.
Yeah, and I
He was
think
just-
he was a good friend of yours, wasn't
A
he?
dear friend of mine.
Yeah. Well, we will see each other. I'll be there the right week now.
Okay, good. That's
But
good.
Ed and I went last week, and I actually had to call the funeral home and say, "Did they move the venue?" He said, "No, Joan, it's next week." So we will be there this week. But we didn't want to miss it.
Well, you know, all of this stuff about dying is an automatic reaction that we have in our society is, oh, it's awful. You know, it's terrible. It's such a tragedy thing. It is a tragedy when it's premature, but when you're an older person and you've gone through a good life and had good things, it's really a time to celebrate if it's the time you and we just don't want you to be dragged through suffering. That's what we don't want to have happen. And none of us want that suffering. We'd like to go out with some class. And
You know,
he did. The
did.
week before he died, I was over at the nursing home. I wasn't in seeing him, but he said, "Rick, I got to talk to you." So he dragged me off to the side, and it was about an hour conversation with him, and because although his kidneys had been failing and he had been worrying about his kidneys for a long time, this was about his book. He wanted to get that book done, and he wanted to get it printed, and then he started talking about somebody to review his words and gets a professional to review how he's written things, because he, even though he was a very smart and an excellent writer, he wanted a professional to review his notes and redo the English and make it just exactly right. And we called a lady from Syracuse. I couldn't believe it. I found her telephone number in the computer, White Pages. You know, you go to White Pages and it'll find a name. It's an app. And she answered the phone, and the two of them had a half an hour conversation on my phone about his book. And it was very interesting. And I'll give you one comment. I'm going to say this tonight. So if you're going to close your ears if you're going to the memorial weekend. But she said, "Oh my God, you're in a nursing home, Norman. Oh, I'm so sorry. I'm so sorry." His answer was, "No, it's not. It's not awful. It's very nice. I need to be here. They're very kind to me. This is where I need to be." I mean, you know, I think to myself how many people say, "And I never want to die in a nursing home," you know, and the answer is, 5-star hotel? Are you sure you wouldn't want to be there when you really need some people to help you? Here's the other option. You have your family helping you, except now they're helping you in ways that you really wouldn't want your family to be doing, and then you're dependent on them, and they're kind of angry because they have to be helping you instead of going to the lake to go sailing or whatever it is that you're supposed to be doing. And
Nursing homes can be a very positive thing.
It's a wonderful
we're
place.
We're fortunate in this community to have good nursing homes. That's
have-
the drawback. You do hear the ugly stories of nursing homes that don't care for their patients, but in Brookings, every nursing home is they do
Well,
a wonderful job.
I can speak for Arlington, and I can speak for Esteline. Those nursing homes are fabulous nursing homes as well. So we are, and I can speak for D. Smith. We are surrounded by, people who are caregiver by nature. That's part of this whole South Dakota character. And so those are wonderful places. And, I've watched people come from Brookings to Arlington and Arlington to Brookings. And I don't practice at Esteline, but I'm the medical director at Arlington. I'm honored to be the medical director there. They do wonderfully. Our middle son is a nurse at the neighborhoods at Brookview here at night. Does the night shift. My in-laws lived in the ULC, and my mom was at Brookview Manor before it, you know. So I've got true experience in all of these places, and I have to say, these are great places. And the people
Excellent
who
care.
live there, it isn't, oh gosh, Norman, oh, it's so sorry, I didn't know it, it's terrible. No, he said,
It's
this
the
is a
place
good
for
place.
me. It's good.
I need to be here.
Okay. Well, we need to take our final break. We'll be back right after these words.
Clear?
Well, that was nicely said for nursing homes. We're happy to have you here. We're glad to be here too. It's just a beautiful summer day, and we're talking about death and dying, which is okay because it's part of living.
You know-
live, you die. You talked about, people get sad going to funerals or wakes. I grew up on the west side of Chicago, where my mother morning paper was the death notices. She read them every morning. If the person had an Irish last name, I would be with her at the Irish wake.
Oh.
If she wasn't sure who it was, she'd call my Aunt Lil and say, Lil, do you, yeah,
Should
I
we
read it,
know
Mary.
that-
Guess what? That is Mabel's sister's uncle's son. We have to be there. So we would all, and my dad was not going to attend all these wakes with her, and she just would drag either my sister or I. So I went to many Irish wakes. They were all celebrations of life. I even went to wakes in homes. That's a lot of years ago, but in the 50s,
Where the cat.
the casket was in the home and the beer was in the kitchen.
And
I was too young at the time to
But
enjoy
they had beer in the kitchen.
Oh
and
yeah, the casket
everybody
was
be
in the
drinking
living
beer
room or in the hallway, and most of them were in funeral homes, but there was still some in the home, and they were celebrating the life of the person who died. So I've always had a positive attitude towards going
That's really-
to wakes or funerals because
You know-
you're celebrating a life.
I think the Indian culture, the South Dakota Indian culture, also has that same thing. You know, that's very interesting. They did studies about who respects the elderly in the world, and the Chinese and the American Indians hold the elderly up and respect and treats them with respect and nobility, much better than the rest of us. Maybe the Irish.
Maybe.
But they also have the same kind of, it's a good day to die. It's not, I'm afraid of it. No, this is a great day. It's a great day to die.
Beautiful day. Yeah.
And so I think we panic about this. I mean, we need to get over it. The fact is, we will all get there. It's not, it may be the end of the earth for you, but it isn't the end of the earth. What we need to realize is that that day will come, and so while we're here, we should have a good time and enjoy it and celebrate it. You try to do that, Bob. I try to do that.
Enjoy every day. While you're talking, I'm trying to come up with a name. Another gentleman who just died, he taught death and dying with my husband. You know the name?
Charles Blasey.
Blasey, Chuck Blasey, and my husband Ed, every summer for a number of years, taught a course at South Dakota State on death and dying, and the present doctor, Dr. Holm, would come in and give a lecture. They loved Dr. Holm's comments on death and dying. It was just really positive. Ed and Chuck, that was their favorite class. The two of them absolutely loved teaching that in the summer.
They loved that class. I could tell it was a small seminar. There was probably 6 or 8 people in the room. And almost every summer I'd be invited to be a guest lecturer. And I'd come in and we would talk about, it was really an open-ended deal. I would the first time I was kind of prepared. The
And
second
then you
time
realized-
you didn't know where the students
Where
were
the
going to go.
conversation was going. Right?
And it was a wonderful deal. It was, Dr. Blasey was, his whole story was health, and Dr. Hogan, his whole thing was geography. And I said, now what does geography have to do with death and dying? And he said, well, cemeteries. We designed cemeteries. I think they they pulled
funny.
it. They stretched it so the two of
Yeah.
them could do a death and
Well,
dying
he
course.
also had a doctorate in sociology. A lot of people don't know
Oh,
that.
really?
Well,
Yeah.
So his doctorate was sociology and geography, but he preferred geography. He gave all credit to geography, but I think the sociology gave him the background for doing it. But he would correct me on that. It was all geography.
Yeah.
Because his life is all geography. But basically, he and Chuck just put this course together and loved it. So it's a positive thing. If you're facing losing a parent, a grandparent, a husband, a wife,
Rejoice.
rejoice at their life that they lived,
Yes,
right?
that's it.
Right.
That's it.
Well, we're just running out of time. We hope we haven't brought you down. We tried to bring you up with
Yes.
this program, and we hope you've enjoyed this Prairie Doc program, and we'll listen again for Prairie Doc, brought to you by the Vera Medical Group Brookings. As always, you can hear and see more from Dr. Home online at prairiedoc.org. Thank you for joining us today, and thank you, Dr. Home.
Thank you, Joan Hogan and Bob. And we need to realize that that this is a beautiful day. That summer is here. Let's savor this day to its ultimate, and stay healthy out there, people.
It's a good day to be alive.
It's a good day to be alive.
It is. And I want to thank each and every one of you for letting us be part of your Wednesday. And I invite you to keep in mind here, we have Jay Rowe. He'll hop in the air chair next and take you through the midday on this Wednesday. You're listening to AM 1430 KBRK.